Hi, my name's Tyler, and I'm a developer for the Socal on FHIR team. This is Deliverable 3, and I'll be presenting it. This slide will be updated once we push the presentation to YouTube. Here's a quick update of our project status. Our Docker image setup and FHIR integration are complete, and the work on the front and back end is ramping up significantly. We still have a lot to do on the front end and back end tasks. On the back end, we need to start to integrate in the research that Laura's been working on. The research is almost complete. We still have a little bit to do in relations to cardiovascular disease and medications and activity risks, along with nutritional and diet risks associated with cardiovascular disease. On the front end, we need to add some additional user interfaces and work on the integration to the back end. On the back end, we need to not only incorporate the data from the research, but also integrate in with the FHIR APIs a little bit more. Just a quick technology update. We had to add the Nginx and GUnicorn to our web stack. This is a quick run through of the research that we've completed so far. A lot of this information comes from the CDC and the American Heart Association, and there are different physical activity recommendations that come from that. So we have target heart rate guidelines. We have moderate and vigorous physical activity guidelines and example workouts. We also have diet and nutritional counseling for healthy weight, which includes the BMR, the basic metabolistic rate, which are a couple formulas which we're going to include in our server and backend, and different activity levels, along with how to calculate daily calorie requirements and how to calculate daily maximum calories for weight loss. We also have information for how to achieve a normal BMI for a healthy weight and different categories that correspond to this as well. And an example weight loss plan is shown. We also have research for different diet plans, including how or what are heart healthy carbs, proteins, fats, and what fats, proteins, and carbs that should be avoided. So which ones can be included on our diet plans and which ones cannot be included on our diet plans, as well as some example diets such as balanced, low carb, ketogenic, and the amount of carbs, proteins, and fats that are part of those diets. Our current research that's in progress that we're going to be wrapping up includes research for specialty diets that correspond to cardiovascular risk factors, and we're researching foods that affect prescription medications because that can have a drastic impact if we have a patient who isn't able to eat certain foods, so we have to make sure that we're able to recommend specific diets that they can actually use, as well as research medications that affect heart rates and provide alternate physical activities for those patients who are unable to raise their heart rate above a certain level because of some medication that they might be on. Here's a quick demo of what we have so far on the front end. Since this isn't attached to a back end, you can use any username and password that you want. The login screen takes you to an observation history and risk assessment score page. So the risk assessment score will be based on the observation history and will hopefully show how a patient is improving over time and that their cardiovascular health is getting better. The observations are going to be clickable and you'll be able to do different things with them, and based off of the observations and other factors, we'll populate a watch list that the patient can use to keep track or keep updated or maybe look out for certain things. On the side, you're going to be able to add individual observations. This is just an example right now, and you can add different things: LDL, HDL, blood pressure, and then once you add it, it takes you back to the main page. And then we're also going to be working on our counseling page, which will show the diet and exercise plan that is customized for each individual patient. And then of course you'll also be able to sign out. Our only concern right now is that we don't have or know of a method to do OAuth 2 integration. We thought that we would be able to do that through FHIR, but we're not able to do that. And currently we don't have any set resolution plan other than that we have to do a little bit more research into it. We've also updated the NAT chart to account for all of our development and research work through this week.